They're now a couple months into the vaccine rollout. The doctors I spoke with said they are still getting these constant comments and questions, misconceptions. So I asked them what their top misconceptions and myths that they get are, and we took those and we polled and quizzed people out here on the streets.
I think when people hear that the vaccines that are approved are RNA vaccines, they immediately think there's something going to be inserted in their cells.
Infectious disease doctor Hulita Mir says the misconception she hears the most is that the messenger RNA vaccine can alter or interact with your DNA.
That is false. Is there a prize?
The prize, knowing you were right. Doctors say the mRNA vaccine teaches your immune system to recognize and fight COVID-19, but never enters the nucleus of a cell where DNA is kept. That brings us to our next misconception. The vaccine injects the COVID-19 live virus into your body.
I think it does because I got sick after when I did the vaccine. I think I got sick. I got body ache. I have symptoms like I got the COVID.
This is false. It's not a live virus. There are vaccines that are live. This is not.
Doctors say the mRNA technology can cause symptoms, but that's actually proof the vaccine is working. Misconception number 3. The vaccine will stop you from getting and spreading COVID.
From everything that I've read and heard is that you still could be a spreader with the vaccine.
I think it prevents hospitalization and really intense side effects.
This was actually a trick question. Doctors say this is mostly true. Both vaccines are very effective at preventing symptoms, even if you do get COVID. But spreading the virus?
Great question. The answer is not clear. We think that the data will show that people who are vaccinated have lower chances of spreading the disease.
Last but not least, the vaccine stops you from getting pregnant. False.
There's no evidence that this vaccine will alter the capabilities of getting pregnant. Now, in terms of what are the consequences of vaccinating a pregnant woman, right, or a small child, that data is not available yet.
Another common misconception, Vanessa, that testing positive for COVID-19 means that you can skip the vaccine. CDC says that is false because we have seen multiple people get the COVID virus more than once.
We all learned a lot from you, Wale, tonight. That was great stuff. And let's talk about this, though, because we know there are also some misconceptions about what people can do once they've been vaccinated.
Yeah, this one's layered. Doctors say, first of all, even after you get that second dose, it still takes weeks before that efficacy kicks in. So you still have to wear masks, practice all the COVID protocols, and yes, be hesitant on travel. Dr. Mir says you can go ahead and book that flight or whatever a few months down the road, but be careful because you have no idea, Vanessa, what the restrictions will look like several months from now.
A lot of people eager to travel, hoping those restrictions will be loosened. Wale.